A two-level discectomy and fusion will be performed using the cervios cages and additional fixation with a cervical spine locking plate. The anterior longitudinal ligament and anterior annulus are cut through to create a window for access to the disc space. The rongeur and the curette are used to prepare the disc space. The rongeur is used to remove the disc material, and the bone curette is used to scrape the vertebral end plates clean of all cartilage, taking care to preserve the end plate integrity. All osteophytes must be removed. With the drill and T-handle for the Caspar distractor, the hole for the distractor screw is drilled in the superior vertebral body. After removing the drill, the screwdriver for the Caspar distractor is used to insert the 2.7 mm distractor screw. The screwdriver is removed, leaving the screw in place. The process is repeated for the inferior vertebral body. The Caspar distractor is placed over the distraction screws, making sure that the settings are still loose. Now the distractor settings are fixed. The distractor tab is turned until the required distraction is reached. Care must be taken not to over-distract. The trial implant is inserted into the prepared disc space using the implant holder and depth limitator. The distraction can now be released to check the fit of the trial implant. Once the fit is correct, distraction is reapplied and the trial implant is removed. The appropriate cage is inserted into the prepared intervertebral space. The distraction then is released. The implant holder is removed by turning the wheel in the handle anti-clockwise. The settings of the distractor are loosened. The distractor is repositioned for the distraction of the next intervertebral space. The steps are repeated, and the second cervios cage is inserted into position. The distractor pins are now diverging due to the cages and illustrate the increase in lordosis. The cages should lie about 2 mm posterior to the anterior border of the vertebral body and in the midline when seen from the anterior view. The plate is put in position over the levels to be fixed. There are two different self-holding cruciform screwdrivers. The 4.0/4.35 screwdriver below is used for the expansion head screws and the fixation pins. The 1.8 screwdriver with holding sleeve above allows the locking screws to be taken from the tray directly to the screw heads without any risk of them falling into the wound. The fixation pin is picked up using the self-holding screwdriver. This pin is used to fix one of the cranial screw holes of the plate in position. The same is done for the contralateral caudal screw hole. The drill guide is released from the plate by pressing the handle. It is repositioned in the free cranial screw hole, once again being locked firmly into place. The 3 mm drill bit with 14 mm stop is inserted through the drill guide. A hole is drilled until the stop is reached. The drill bit and drill guide are removed, and the 4 mm expansion head screw is inserted with the self-holding screwdriver. The procedure is repeated for the contralateral screw hole. The fixation pins are removed, and the procedure is repeated for the remaining holes. The screws must be flush with the surface of the plate to avoid damage to soft tissues. Now the 1.8 mm locking screws are inserted into the expansion head screws using the 1.8 screwdriver and the holding sleeve. Once again, the screws are checked to make sure they're flush with the surface of the plate.